with compassion, while murder is motivated by malevolence. The ethical and legal debates surrounding euthanasia can be complex, especially when the consenting capability of the individual is questionable or the intentions for providing assistance are unclear. It is crucial to understand the principles that govern euthanasia: autonomy, beneficence, and non-maleficence. Autonomy supports the patient's right to choose their treatment path, including opting for euthanasia under specific conditions. Beneficence involves healthcare providers acting in the best interest of the patients to alleviate severe suffering. Non-maleficence, which translates to do no harm, advocates for not prolonging suffering when no prospects for improvement exist. The impact of euthanasia extends beyond the individual, affecting society as when conducted responsibly and ethically, it can foster compassion and offer a dignified conclusion to life, easing the burden of unbearable pain. However, its practice can also ignite profound emotional, ethical, and societal debates. While some view euthanasia as a diminishment of life's value, potentially leading to a slippery slope of broader justifications, others regard it as a crucial right and an expression of profound personal autonomy and mercy, prompting discussions that challenge societal views on life and death. Global attitudes toward euthanasia differ widely, influenced by varying cultural, religious, and legal perspectives, making the discourse surrounding it inherently complex and requiring continuous. Euthanasia is performed using a variety of methods, all aimed at achieving a peaceful and painless death. The most common form involves the administration of a lethal injection by a medical professional. This injection typically contains a barbiturate, an anesthetic drug that induces deep sleep, followed by a drug that relaxes the muscles and stops the heart. The entire process is designed to be as swift and painless as possible, minimizing any discomfort or distress for the individual. Euthanasia can also be achieved through the withdrawal of life-sustaining treatments. This method, often referred to as passive euthanasia, involves the discontinuation of medical procedures or medications that are keeping a patient alive. For example, turning off a respirator or discontinuing a feeding tube can lead to the patient's death. The decision to withdraw life-sustaining treatment is typically made in consultation with the patient, their family, and the healthcare team. It is a deeply personal decision, often made when the burdens of treatment outweigh the benefits, or when the patient's quality of life is severely compromised. It's important to note that, irrespective of the method, euthanasia is always carried out or supervised by healthcare professionals. It's a regulated process bound by strict guidelines to ensure the safety, dignity, and autonomy of the patient. The role of the healthcare professional extends beyond the administration of euthanasia. They are also responsible for providing the patient and their families with comprehensive information about the process, potential risks, and alternatives, allowing them to make an informed decision. They also offer emotional support and counseling, both before and after the procedure, helping individuals navigate the complex emotional landscape associated with euthanasia. Understanding the methods and process of euthanasia helps us to better comprehend the complexities of this practice. It underscores the gravity of the decision and the seriousness with which it is approached by all involved. It also highlights the critical role of medical professionals in safeguarding patient rights and dignity, ensuring that euthanasia, when chosen, is administered safely and ethically. From an ethical standpoint, the debates around euthanasia are intensely polarized. Critics argue that euthanasia undermines the intrinsic value and sanctity of life, conflicting with both secular moral principles and religious doctrines that hold life as sacred. They fear that accepting euthanasia as a norm could diminish societal respect for life, particularly among the most vulnerable populations. Legally, there is a deep concern that euthanasia can lead to a slippery slope, potentially resulting in non-voluntary or involuntary euthanasia cases. This fear underscores the necessity for stringent legal safeguards distinctions between voluntary and involuntary acts. The medical opponents contend that euthanasia contradicts the foundational medical ethic of do no harm. It challenges the duty of care that healthcare professionals are sworn to uphold, which is to preserve life rather than end it. Alternatively, palliative care is championed as a humane approach that enhances the quality of life by providing comprehensive relief from pain and other distressing symptoms. Unlike euthanasia, palliative care does not seek to hasten death, but rather aims to offer emotional, spiritual, and practical support to patients and their families, respecting the natural course of life. The practice involves advanced pain management techniques and integrates psychological and spiritual aspects of care, ensuring patient comfort and dignity. Additionally, advanced care planning is a critical element of palliative care, enabling patients to express their wishes and make informed decisions about their end-of-life care, aligning medical treatment with their values and goals. Critics argue that a stronger emphasis on palliative care, reinforced by ethical guidelines and thorough training for medical professionals, can prevent the drift towards practices akin to euthanasia, thereby honoring both life sanctity and the patient's autonomy. Scene script. Socially, the impact of euthanasia reverberates through the fabric of communities and cultures. It raises profound questions about how societies value life, deal with death, and support the suffering. The role of government in these intensely personal decisions often becomes a point of contention, reflecting broader societal values and cultural beliefs. As we reflect on these points, it becomes clear that the issue of euthanasia is not merely a legal dilemma or a medical debate, but a profound commentary on our societal values and our compassion. It challenges us to think critically about autonomy, dignity, suffering, and ethical responsibility. In conclusion, the discourse surrounding euthanasia remains a testament to its complexity and sensitivity. It demands a nuanced understanding and a compassionate approach, recognizing the profound moral, ethical, and personal dimensions at play. As societies evolve, so too will the conversations and laws surrounding this most personal choice. Whether one views euthanasia as a compassionate response to unbearable suffering or a challenge to the sanctity of life, it undeniably prompts us to confront the depths of human vulnerability and the breadth of ethical responsibility.